This is Leon, counselor here at Evolutions Treatment Center. I wanted to shoot a special video because it is Mental Health Awareness Month. So I wanted to discuss a little bit about mental health and addiction. There's many people that come into treatment and they usually have a dual diagnosis. For the most part, they come in with a substance use disorder or alcohol use disorder, and it may be accompanied by an anxiety disorder, a bipolar disorder, depressive disorder, a personality disorder. And here at Evolutions Treatment Center, we are a dual diagnosis facility, so we don't just treat the addiction. When we do the treatment plan, of course we cover the addiction as it is a primary problem, but sometimes the mental health can be just as primary as the addiction, and we make sure that we address that here at Evolutions Treatment Center. Now, we also have a psychiatrist who sees the patients on a daily basis when they're here at the inpatient level of care. And there's medications that some clients will be placed on that may be very beneficial to them in their recovery and will help them to prevent relapse. So for example, if somebody comes in here and they struggle with obviously their addiction and they have an anxiety disorder, one of our good doctors, Dr. W, who's been doing this for a very long time and very intuitive with medication prescriptions and knows exactly what each person needs, may prescribe them to something like Zoloft or Effexor, and that some of these medications, they take a few weeks to take effect, but once they actually do take effect, it is night and day. I've seen people come in with the worst kind of anxiety. Everything was giving them a panic attack, and once that medication actually starts working, you really do see the difference in them. And because now the edge is off from the anxiety, they're so much more likely to maintain sobriety, because sometimes the anxiety or the depression and the edge that you feel from it takes a lot of people back out. So for some of us, it'll be important that come into treatment that we make sure that we address the mental health parts, because those things are very real and are very necessary to address in order to maintain long-term sobriety. Another thing that happens sometimes, especially with dually diagnosed clients, is that they start feeling better and they start experiencing joy, and there's a lot less anxiety and depression, and they start thinking that they don't need the medication anymore, and they just taper off of it on their own. It is so common, and it contributes to so many relapses. So the whole aspect of medication management compliance is so important, and there's absolutely nothing wrong of coming off the medication, because that's the goal. It's not, you don't want to be for life on the medication, unless of course you're a psychiatrist and you believe that it is necessary, which is okay too. But eventually a lot of people do come off. They taper off slowly with their attending psychiatrist, and that point they build a good foundation that they don't need medication anymore. They can manage their mental health. So if you're struggling with mental health and addiction, know that it's okay. There are so many of us out there that do struggle with that, and just know that there is a solution, and here at Evolutions Treatment Center we can help you out.